we looked at our exercise test database from 1993 to 2010, and we picked out about 13,000 qualifying patients from Minnesota, and we followed them up with cause-specific mortality over about 13 years. So we got a long follow-up. And the principal finding in the study was that three variables, exercise capacity, defined as performance on the test, the heart rate recovery, how quickly the patient recovered from the test, and the peak heart rate on the test, all predicted not only cardiovascular death, but also non-cardiovascular death. I'm Dr. Tom Allison. I'm in the Department of Cardiovascular Medicine here at the Mayo Clinic. I run the exercise testing labs, and I'm going to talk to you today about a study that we're publishing in the Mayo Clinic Proceedings, and the title is Exercise Test Predicts Both Non-Cardiovascular and Cardiovascular Death in a Primary Prevention Population. My colleague, Dr. Nora Shido, is the principal author on this, but she's in Budapest at the moment, so I'm going to give this little presentation. As it turned out, cancer death was the most common cause of death in this population that we studied. Now, what does this mean? What does this mean for a patient? Okay, well, it tells us that maybe when you get to be about 60 or 65, you ought to get a stress test, see how long you're going to live. Now, I'm somewhat joking here, but not completely joking, is that careful assessment of the exercise capacity is very important for predicting your long-term survival. For physicians, we remind physicians and other healthcare providers that exercise capacity, fitness, cardiorespiratory fitness, is a vital sign, and it should be assessed in some manner, whether informally through discussion with the patient or preferably formally on an exercise test, should be an important part of every general exam. And so those are, I think, the take-home points here is, again, the importance of being fit and the importance of assessing that fitness to predict your long-term health and survival. Now, the question might be, why is exercise capacity predicting non-cardiovascular death? I thought this was a cardiac stress test just for the heart. Well, there's a couple things. First of all, we know that healthy behaviors tend to cluster. So people who exercise well are also likely doing a lot of other things well, like not smoking, controlling their weight, eating healthy. We also know that cardiovascular risk factors, like hypertension, for example, which predict cardiovascular death, also predict non-cardiovascular death. Cancer, for example, stroke death, diabetes death, kidney death. And so that these risk factors affect your ability to exercise, and so they're going to predict your outcomes in many different conditions. Now, very important data have been presented showing that survival from any disease is very strongly related to your cardiorespiratory fitness level and your strength level. And our study was not predicting the incidence of cancer. We're not saying that a stress test can predict whether you're going to get prostate cancer or breast cancer. Maybe to some small degree it can predict incidence, but more importantly, it predicts mortality from cancer. Will you survive cancer? Will you survive a fall? Will you survive pneumonia? COVID sort of out of the picture. I don't mean to mention it, but we also know that people who were more fit were much less likely to die from COVID. So very important vital sign that should be assessed. And our study shows that this is not just true for cardiovascular disease, but a wide variety of diseases and for total mortality. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.